911, I've been having really bad chest pain.
Hey sir, how you doing? I'm Billy with Dallas County EMS.
Hey, I've been having really bad chest pain, man. Really bad chest pain. It's been going on for a couple.
The primary assessment shows that the patient has no immediate life threats. So let's move on to our differential diagnosis. As highly skilled clinicians, we should be thinking of all the different possibilities causing the complaint for the patient, some of which could be acute myocardial infarction, pulmonary embolism, angina, pneumonia, pericarditis, aortic dissection, or simply just anxiety. All of these options should be in our head. That way, we can do our best to narrow down the cause of the complaint.
Hours now.
Okay, when did it start?
I was taking a nap. I woke up. I had this sharp pain in my chest.
It's
terrible. Oh, okay. Oh, thanks.
All right. Well, when does has this ever happened to you before?
No,
no. Is this new to you?
No, I've never had it like this.
Okay.
Yeah.
My partner's gonna get a set of vitals over here.
All right, this is really bad. This is hurting
Explain to
really
me
bad.
the pain that you're feeling.
It's like this sharp pain, like I'm being stabbed in the chest.
Stabbed in the chest doesn't go anywhere.
It feels like it's in my back too. Like it makes my back hurt. I can't get comfortable. That's the problem.
Okay, we're gonna do some testing here to evaluate you and see how you're going.
All right.
Do you take any medication?
I take blood thinners, but I'm not really good about taking them. To be honest with you.
Do you have any kind of medical history that we should know about?
I have hypertension.
Hypertension?
But that's it.
Okay, any surgeries, anything like that?
I had a recent knee surgery on my left knee, but that was like 6 months ago.
6 months ago. Okay. You allergic to anything?
No.
Okay. How'd you eat today?
I ate breakfast a couple hours ago.
Okay. And what were you doing when this pain started?
I was just taking a nap. I woke up and I was just in like excruciating pain.
The sampler history in OPQRST, coupled with our diagnostic tools, is what will help us narrow down the differential diagnosis. So, with the information we just obtained, some red flags would be recent surgery, 10 out of 10 on pain, sudden pain after not moving for a while, and not being compliant with meds. Let's see what else they can find.
All right. On a scale of 1 to 10, how would you rate that pain?
It's a 10, man.
It's a 10?
It's a 10. That's a 10.
All right. Well, we're going to get some vitals here and see where it's going.
Okay. Well, that really hurts.
Let me see a finger there. Put some electrodes on you here. Well, you already have some up here. Did you just get out of the hospital?
Yeah, I was in the hospital for I had some respiratory issues that were going on.
Yeah?
Yeah, the other day.
Can you tell us more about that?
No, I think actually it was just a panic attack. I've been arrested recently.
Uh-huh.
And for spousal abuse, and I think I was just, I saw some police drive by. I got a big old panic moment.
Uh-huh.
Yeah, so I called, but they took me to Morton Plant. I still had the band on. Just got out of there.
Yeah. Okay. And what did they say when you left? They give you some discharge instructions? What did they say?
No, they said just to keep taking my medicines that I was supposed to be taking.
And do you have your medications?
No, I don't.
You don't?
No.
So you haven't been able to fill them?
No.
Did you tell the doctors that? The nurses?
No. I just want to get out of there.
Okay. All right. What would you like us to take you to the hospital today?
I mean, what do you guys think? Should I go to the hospital? I mean, this is pretty bad.
Absolutely.
It's pretty
Anytime
bad.
you're having pain like this.
Yeah. There's several different things that could be wrong, and we can only diagnose certain things. I mean, you could be having a heart attack. You could be having, you could have an infection. You could have a blood clot in your lungs. You could have a problem with one of your big vessels in your heart.
Okay, yeah, because it's really uncomfortable. I think you should go to the hospital and get checked out.
And do you want to go back to Morton Plant?
Yeah,
They're pretty good hospital.
If you think that's the best thing, then yes,
Yeah.
absolutely.
All right. Okay, we'll get you loaded up and get you moving that way.
Okay.
I don't see any abnormalities in the 12 lead, any ST elevation or problems there, and in the no problems with the axis deviation.
Well, now we can rule out acute myocardial infarction, but this is a high-risk chief complaint. Sometimes we just don't have all the diagnostic tools that are needed to narrow down the differential diagnosis anymore, that we can. So let's see how they handle it.
All right. Certainly we need to get to the hospital. We need to get to the hospital, and we'll have the doctors check you out from there. All
Okay,
right.
thank you.
All right.
Great job, guys. Turns out the patient had an aortic dissection, and because of their quick thinking, that patient is back to normal in no time. Remember, high-risk chief complaints are a serious matter.